How you doing? My name is Tom Willman. This is Apex TV. I'm really excited. We're having David Miller from Miller's Pharmacy in Wyckoff today. We're going to discuss a little bit about Miller's and kind of being here in Wyckoff, multi-generations being here in Wyckoff, and a little bit about his background and some topics on medications that come up to me in the clinic a lot of times, some topics that you heard in the media, things you're probably wondering about. Pharmacists are just an amazing resource, and Dave is an amazing resource for questions. And I always encourage people, ask the pharmacist, the doctor told you this, make sure you kind of verify that and have a dialogue. And a lot of times the pharmacists have more time to talk to you. So David, tell us a little bit about the history of, many generations here. You said your grandfather was the first started.
Yeah, Tom, thank you for coming this morning, and thank you for setting this all up. It's a great idea.
Great, thank you.
I think you're developing a library of nice community resources, and this is a great way to get the word out that these resources are available to people. Miller's has been here since 1929. My grandfather actually started in 1918 in Passaic, and this was the country in those days. He used to come up here to vacation, and when his pharmacy failed during the Depression, some of the people from town here asked him if he could set up a pharmacy in Wyckoff, and we've been here ever since.
Wow.
So he had a traditional pharmacy and liquor store, which was the model in those days. My parents, who were both pharmacists, took over from him in the 50s.
Okay.
And in the early 60s decided that they wanted a more professional model. So they threw out all of the sundry products, all the candy, the greeting cards, the cosmetics, all of that.
That's right.
And they literally, they had a sale, got rid of it, and if you walked into the pharmacy in 1972, it was a red carpet with a potbelly stove and nothing on display. Everything was by recommendation from the pharmacist.
Wow.
So you'd walk in and say, okay, I've got this headache or I have a cold, and the pharmacist would go to a cabinet, pull something out, hand it to them, and explain how it was to be used. And that's how it worked. It was a traditional role of the pharmacist in a small community to kind of be the primary care practitioner.
Yeah.
And that people would come to my grandfather or they would come to my parents, and my parents would determine if they were sick enough to go to the doctor.
Wow, you're like a gatekeeper,
like
kind of
gatekeeper,
primary care.
It was very informal.
Huh.
And in many cases there would be one pharmacist and one doctor in town. So in our case that was the case. There were two doctors in town. People would come to my father or my grandfather, and that was Doc Miller.
Wow.
And he would pass them on. So in the 70s and late 60s they got involved with Medicare, which was the dawn of Medicare, and decided to become more involved in medical equipment and brace fittings and things of that sort, and more professional things. Really services for people rather than just products that they could buy.
Right.
That's evolved over the years. In the early 80s, I got into the practice, or I came into the practice, and I started the compounding area.
Oh, that's exciting.
Which was an interest of mine, mainly in response to my interest in hospice pharmacy.
Okay.
I was on 5 different hospice committees. I was going to team meetings every week.
Wow.
And we were looking for alternative ideas, ways that we could provide medications to patients who could no longer swallow. And we developed a whole list of medications and ways of delivering them to patients that were rather novel for the time.
So when you do compounding, like what happens if someone sends a script over to you, for compounding? Like do doctors actually say, I want this medication this year, or is there common formulas? Or?
Well, some doctors are very experienced in writing for compound medications. In the 20s and 30s, everything was a compound.
Right, that's what we did.
My grandfather's pharmacy, they were powders, and he would mix things up for people.
Wow, that's like...
And doctors had their own little formulas. Doctor would write a prescription that would say, Dr. Smith's formula number 1, and my grandfather would know what that was.
That's the number. Oh, wow.
And he'd make up a couple 100 of those capsules, and they'd be on the shelf, and he would pull out Dr. Smith's formula number 1.
Wow.
Over time, it became a little bit more complicated than that.
Right.
Because we now have thousands of medications that we can compound into different kinds of medications. We can use for veterinary applications. Sometimes we're called on to make very tiny doses for very small creatures.
Right.
Okay. The way they metabolize medicine is different than humans, so we have to be very careful to work with the veterinarian to make sure that we're got a safe medication that's going to be effective.
Okay.
We do a lot with pediatric suspensions. When a medication is not commercially available in liquid form, the pharmacist will research to see if it's stable in liquid form. If it is stable, how long is it stable for?
Shelf life,
the shelf life, which in many cases might be a day or two, it might be a week, it might be 2 weeks, or it might be longer. But we have to find good sources for that information.
Right.
We flavor it.
Of course.
So we'll do anything from tutti frutti for a child to liver for a dog. So we have a wide variety of flavors that we use in the pharmacy and the lab. And then we began doing more sterile compounding. Sterile compounding would be something like an IV medication or an eye drop. We make a lot of different kinds of eye drops that are not commercially available. Typically things that are stronger than commercial products. Somebody comes in with a raging viral infection. We may, the ophthalmologist may ask us to do something unusual for that patient. And we can do that here because we have the facility for it.
Yeah, that's exciting.
We have 2 sterile rooms in the laboratory and specially trained staff to do that.
Yeah, that's very uncommon. You don't really hear a lot about compounding, and really having that specialized service is pretty amazing. There's a lot of research, like you were saying, understanding how long the suspension lasts, how long, you really have to do your research, understand, the chemicals.
Well, and it's really important. I mean, an example of that was we make some natural thyroid preparations, and we found out that the potency of the thyroid, if it wasn't compounded correctly, would drop off after a few days. And by 30 days, there was nothing left. And it turns out that the drugs are very light sensitive. And temperature and humidity sensitive, so they have to be made under very careful conditions. If a compounder isn't doing their homework, the compounded thyroid is simply not going to work.
Interesting. Do you have anything within orthopedics that you work with as far as any kind of compounding, or what would you?
Well, there's a commercial product called Voltaren Gel, which is a topical gel. We were doing that for 20 years before it became commercially available.
Oh, okay. I didn't realize that. Yeah, it's very popular now. Yeah.
It's very popular now, and you absorb a lot of things very well through the skin. And we make a lot of topical anti-inflammatories, so that rather than having somebody take an ibuprofen orally, they can just take a compounded cream and just rub it over the affected joint. For example, and there are fewer side effects in doing that. Yeah,
you don't have that systemic effect as much. It still can have some impact, but not nearly as much as the orals, right?
It's true. I mean, it's not uncommon for someone to call me up after they've applied Voltaren Gel, for example, and say, I feel a little nauseous, my stomach's bothering me. There is enough absorption to have somewhat of an effect, but not nearly as much as when you swallow the tablets.
Exactly. It's funny, we talk about oral anti-inflammatories, and it's a great option, because what are some of the things with the oral anti-inflammatories, the over-the-counter and prescription? What are some of the concerns that patients should kind of be aware of and be kind of sensitive to?
Well, the most important thing, of course, is that they be taken on a full stomach to try and prevent a GI bleed. These drugs are very irritating to the stomach lining, and if you have someone who's a chronic ibuprofen user, for example, they can get in serious trouble. They develop ulcers, they can have perforations, and GI bleeds. The way to prevent that, if you can, is to, first of all, take as few as you can. You don't want to take those chronically if you can avoid it. Take them on a full stomach. And also, it upsets the GI flora. So we found that by taking high doses of probiotics, it can also somewhat offset the effect of an anti-inflammatory.
I always talk about food with it and everything, but the probiotics, that's definitely, with the impact on the flora.
You're going to hear a whole lot more about the microbiome over the next 5 or 10 years. There's a lot of things being studied. And a lot of these effects that we thought might have been a direct physical irritation of the stomach lining might actually have more to do with the fact that it's upsetting the GI flora. And by replacing it, you're doing a lot to heal that injury. So
that's interesting, because I always think about probiotics with antibiotics, and I always say, I always think that I hadn't thought about as much with the anti-inflammatory. So that's great too.
From now on, all of your patients.
Yeah, I will tell them.
Absolutely, tell them to get onto a probiotic.
Okay, excellent. Is there anything else about anti-inflammatories as far as orals? We talked about the ulceration, perforations. What about liver toxicity or anything like that?
Well, there's some drug interactions. There can be some liver toxicity, but I think you'd probably have to take a whole lot of anti-inflammatory or over a long period of time for that to happen.
Okay, yeah.
But the drug interaction can happen right away, and the classic one is with a blood thinner. Okay, as you mentioned, Plavix. Really, more importantly, Coumadin, warfarin. Drugs of those sorts. So you should not take any anti-inflammatory or any other medication at all without checking with your doctor first or with a pharmacist. To make sure that it's a safe combination. And if you're taking warfarin, you don't take anything unless you talk to the pharmacist or the doctor.
It's pretty powerful.
Yes. Okay.
Yeah, it's pretty intense, the effect of warfarin, and
it really is. Well, plus there's also some nutritional things that have to be considered. You have to be aware of the fact that you shouldn't be eating certain dark green leafy vegetables because they have vitamin K in them, and they're going to counteract the warfarin. So there's a whole lot of discussion time that you need with your doctor or your pharmacist regarding that.
So that green leafy kind of anti-inflammatory diet you're saying actually will then cause a hyperthinning kind of, is that what the...
It's the other way around. It reverses the effect of the warfarin.
Oh, excuse me. Oh,
yeah,
okay.
It's a clotting factor. Well, not a clotting factor, but it increases the blood clotting for vitamin K.
Okay. I didn't realize it was the K that was the big issue with that. Anything else about anti-inflammatories that you've come across, or anything interesting?
The way they should be used. For example, we're very involved in holistic medicine. I won't call it medicine because it's a pharmacy, but in holistic healing here, certainly.
Right.
And there is a right way to use an anti-inflammatory related to a sports injury. And I'm sure you probably counsel your patients on this all the time, but what we see in a lot of professional athletes is they're told to, if they have to use an anti-inflammatory, they use it before the activity, but not after, because it does inhibit healing.
Yeah.
Right? So you can use it to keep the inflammation down, and then after the sporting event or whatever you're doing, ice becomes your best friend. Okay. So you'd use an anti-inflammatory before, ice afterwards, and then eventually you may want to recommend to your patients heat or whatever is appropriate.
Right.
That heat-ice thing is always confusing to people.
That's a whole other topic. I'm going to interview someone on is that all,
Okay.
But yeah, that's interesting as far as prior to activity. What you're saying. Okay.
You want to try and reduce the inflammation before, but then afterwards you really want the inflammation because it's part of the healing process.
I've always contended, I'm like, with anti-inflammatories, are we reducing something that's really trying to achieve a healing? We're inhibiting those inflammatory factors. Is that delaying healing? And I know the anti-inflammatories can show some evidence for bone healing, soft tissue healing. So it's the timing. I think what you're talking about is, and that's something that I'm learning more about. As far as that impact. So
there are some natural alternatives. Certainly, we sell a lot of a product called Curamin here, which is turmeric, which is an herb.
Right.
And that's been used for thousands of years. I have an employee actually here who is of Indian descent, and she recently had an issue with some swelling in one of her joints.
Right.
And in her tradition, her family, they actually take the herb and they make a wrap. And they wrap the affected joint in the turmeric.
Almost like
topical. And within a day or two, the swelling was gone.
Wow.
So it's powerful. We're using it in a very concentrated form. Curamin is a proprietary product.
Okay.
And we recommend 2 tablets with each meal for chronic inflammation. You don't have any of the interactions with any drugs.
Right.
You don't have any side effects with the medication, pretty much.
That was my concern. It's like they're natural, but yet they're still going into your system. Is there that cross effect at all?
Well, there are a lot of natural products that can do harm, so we watch for that certainly. But Curamin, I've not seen any problems with that particular product.
That's good to know that. Yeah.
And in fact, I've been using it myself for the last couple of weeks for an Achilles tendinosis, and it's actually working quite well.
That's
which
good.
Surprised me, but. I shouldn't say it surprised me,
but
let's just say I'm now a believer that the product can be effective.
You experience it yourself, it's a different effect. I know the way you think about things sometimes.
Sure. Well, and also with the person who brought it to, of course, is Bob Lukasik, the nutritionist who works here.
Yep.
He's an amazing resource for the community. The man is extremely knowledgeable, and he just recently brought us a PowerPoint presentation. Curamin is being studied at Baylor University.
Okay.
It's not just an herb that somebody's making in their garage somewhere.
Right.
This is a potentially high-powered medication which will be studied and will probably go to more kinds of use that where the FDA might want to become involved and do more studies on what they're doing. But they're doing all the preliminary work on that now. And we can benefit from it because the product is extremely effective.
Wow.
And they can't make any medical claims for it because they can't make any claims for it.
Right, exactly.
But we can recommend it as a supplement.
Okay.
And anecdotally, I've seen a lot of really good results with it, and I know that there's good science behind it.
Right, you feel comfortable about that product specifically. Is there any information as far as like if someone, besides talking to you, as far as supplements and like dosages, like there was like how much do I take? I'm like I don't know. Talk to your pharmacist. But is there any other like a text out there or any kind of bulletins or anything that kind of gives you kind of updates on different thoughts on that or
talking about herbal products or
the different supplements for anti-inflammatory qualities, arthritis, different things like that. Is there like a resource out there for consumer?
I think it's best actually to find someone to talk to.
Okay.
Because you may think you understand what's going on in your body, but you may not be asking all the right questions.
That's true.
So
That's
it's
true.
better to have a conversation. You know, somebody like Bob. We have Bob Lukasik. We also have Stephanie, who is a dietitian.
Okay.
And their two worlds are coming together here,
Right.
because dietitians don't always talk to nutritionists. They have their own separate disciplines,
Yeah.
and they're working with each other now and learning from each other, I think.
That's going to be tremendous.
But it's better that someone came and actually talked. And you know, Bob in particular will, you know, he can talk about the hormone soup, you know, from thyroid to all the other hormones that are,
interesting.
you know, testosterone and estradiols and estrogens. And it becomes a more complicated answer. And to be able to ask the right questions or even look for the right information in a book,
you
just don't have the knowledge to ask the right questions or even to look in the right section. And it's not always that simple. It's not black and white.
Yeah.
It's just a question of, okay, I'm going to look it up in a book. So much more to it than that.
Yeah, I mean, I was more just educational on what would potentially benefit more to provide opportunities for people to learn about it, maybe, and then go to Bob and say, you know, maybe what would really work.
Well, I'll tell you, for just traditional allopathic medications, WebMD is not a bad source.
I've heard that rated as far as quality of information is not too bad as far as overall when you look at other sources of medical information on the web and all that, so it's not too bad. Let's talk a little bit about the whole opioid. It's a big topic right now as far as the epidemic. What are you seeing from your perspective as far as prescription patterns, people moving away from it? What can you say about what's going on in the last few years?
There's a lot to say about that. First of all, there are new regulations that haven't exactly been written yet, but we've seen some of the preliminary information about what's going to be happening. Doctors are required on an initial prescribing of an opioid of any sort. It has to be for a very short period of time, just a few days.
Right.
If it's going to go beyond that, they have to show medical justification for it, and then we'll be able to dispense it for a longer period of time. That said, I just read an article recently which was terrifying to me, and that was that after 3 days of opioid use, the addiction potential doubles.
Wow.
There's the potential that after just 3 days of Percocet, for example, post-surgery, post-delivery of a child, whatever it is, some people are more prone to addiction than others, and that's a whole other topic.
Right.
But the potential is there after just 3 days of usage.
Wow.
After 5 days of usage, I think it doubles again. And then after 3 weeks, it's very likely that you're going to have to taper off gradually because there's already some tolerance. And I won't necessarily use the word addiction because everybody thinks of an addict.
Right.
But you do become addicted to this medication where if if it's not there anymore, you will notice its absence.
Right.
You won't feel well. And it has to do with the fact that you're not taking the medicine. That's a very mild form of addiction.
Yeah, you're having a reaction from not having it in a very short period of time.
In a very short period of time. So these drugs have to be taken very seriously. A number of years ago, we set up a collection bin in the pharmacy. We have to be registered with the DEA to do this.
Oh, wow.
And that if anybody has, for example, if the dentist prescribes a dozen Percocet, you needed 1 or 2 and you've got all these Percocet left over, don't throw them in the trash. Don't flush them down the toilet, please. Right. Then it goes into our water supply. Yeah. You can just bring them here. I have an anonymous bin that's bolted to the floor in front of the pharmacy. Right. And it's like an old mailbox. You just open it up, throw it in, and it's gone. Excellent. And we send it out, and we have it incinerated. Okay. So it's out of our community, it's out of our environment, and a high school kid's not going to find it in the trash somewhere. That's interesting. Yeah, I've heard about just getting into our water sources and the impact on how much different medications everyone's flushing it down and what that's doing to our water sources. So it's There was I think it was either the Hackensack River or the Passaic River. It's one of the few that has a river warden. I'm not sure. I never heard that term. There's only one in the country. I forget which. But the creatures that he's finding there and the genetic defects. Oh wow. It's pretty scary. Yeah, I can imagine. We do not want this stuff in our water. Okay, that's good. Good to know about that. I know that's a great service to be able to just get rid of it. Sue, my wife had maybe 2 Percocets she took after after Matthew, and she said I don't need them anymore, and they're just sitting there, and just you don't want them in the house. You don't want them in the house, yeah. So no, absolutely. Another interesting topic: medical marijuana. It's now legal in New Jersey. I know the indications. I know. Is there any kind of long-term research on it as far as, Well,
I'd love to hear.
it's been in use for
Yeah,
a long time.
time.
But I'm thrilled that it's legal now.
Yeah.
Honestly, because we have a relationship with. When I was doing hospice, I developed relationships with many of the oncologists and pain doctors.
Right.
And as a result, we continue to have that relationship with those doctors. So I see a fair number of their patients here.
Okay.
And I've seen some wonderful successes of people getting off their opioids.
Yeah.
And now all they're taking is medical marijuana.
Yeah, I've seen some fantastic things in the clinic.
It's amazing. And it's something that we should have had for a long time.
I think so too. I mean, my patients for years have been doing it on the street and less controlled, and they said that, they've gotten benefits from it. And they're just, Tom, it's just a better source. It's better for me. I feel better. So I'm glad it's finally legal.
I'm glad there's no stigma. There's no chance of somebody being arrested for using something that's medically necessary.
Yeah, they're not doing it. Yeah, and they're in pain. I mean, it's.
I mean, the one woman was on opioids for more than 20 years.
Wow.
And it took about a year, but now she's just on medical marijuana, and that's it.
Fantastic. Is there what are the indications? So for medical, is there different types of medical marijuana, or there's different things for different indications? Like, I don't know how fine it's gotten. I know you don't do it here.
We don't actually. It's not sold in pharmacies. It's only sold in dispensaries.
Dispensaries, right.
Throughout the state. And as a result, I haven't read that much on it.
Okay.
But as far as I understand, there's just a medical grade.
Okay.
There may be more than one kind. I know it's delivered in different ways.
Yes.
It can be eaten or it can be inhaled. There's a lot of different ways of doing that. But I believe it's all the same product.
Okay. Yeah, I wasn't sure.
I just quoted myself, I guess, but I'm not 100% sure.
Yep. That's fine. Yeah, no, it's something that's come up recently. Some patients have been, starting the medical marijuana and really have had tremendous results from it, in different forms, and I'm just glad it's out there now, So, anything else? What was it about that? I guess you haven't gotten into the details on that, but I'd love to hear about placebos. I think you told me a story about your grandfather years ago.
There's a number of things to say about placebos. For one thing, when I have pharmacy students here, I teach this.
Right.
The way you present a medication is going to go a long way as to whether it's going to work or not. Okay. If someone was to come to me and I was counseling them on a sleeping medication, there's anxiety and they just haven't slept. If I was to go up and say, I don't know if this is going to do any good, but give it a try tonight and see what happens.
Right.
Okay, it's not quite the same as this is really strong.
Right.
Okay, so be very careful how you use this. Okay, yes. It's going to make you very sleepy. Right? Just the power of suggestion goes a long way towards enhancing the effect of a medication.
Yes. Yes.
As far as placebos go, some people respond to placebos, some people claim that they don't. I'm not so sure that's true. But my grandfather used to have a relationship with a local doctor, and he would actually send prescriptions to him for placebos, and basically they were just lactose. It was just a capsule. It would be green capsule number 1.
That was
and it was just lactose. It was just nothing in it. And my grandfather would do what I was just doing to you. He would sell the medication to the patient,
right?
Tell them what it was going to do for them.
Yep.
And more than half the time, it was very effective.
And the rates, they span 50, 60. It's amazing the rates of success with various placebos, medications, surgeries. Mm-hmm. We were just talking about a patient with Parkinson's doing a cranial procedure, and the control groups actually had some success, and it was just just amazing.
Well, that's why we do all of our double-blind studies when we're testing a medication to make sure that it is better than a placebo.
Right.
In many cases, drugs fail that test.
It's interesting to talk about the confidence and really saying, I think it may work, or this is going to really help you. You're going to be really sleepy. Be careful of the dosage, and just that confidence and clarity, and how that, in addition to just whatever the medication is, for all medications, I would say, saying this is, I think just explaining it, educating it, the person about it, and the more I read about placebos, and the new book by Eric Vance, I forget the title now, and talks about placebos. it's on my to-do or to read list and all that, but I'm always fascinated by that, and I think some of it I think also allows us to allow, when you have a placebo also, when your grandfather was doing it, it's allowing a little time to pass. I do think the body sometimes does heal, and I think it allows some time without being more aggressive with other things, or more aggressive procedures. And
I agree. Our job is to help the body heal.
Right.
We're not healing anything per se.
Right.
We're just setting it up so that it might heal faster.
Yep. Yeah. I talk about it in physical therapy as far as triggers. What are you doing that's possibly inflaming your tendon or hurting your back or postures, positions, and if you can adjust that by the education, Also, we were talking about educating what not to take with this medication, how to take it. That's a big component, of what we do and what I do too. So it's interesting, the whole art of medicine, and really getting the most out of a product, a procedure, and just getting that connection with your patient, which I'm sure you have here. Like when I come, before I met David, I'd come here and people are always like engaging me, asking me questions, whether it be medications or anything else, and that education component, and it really makes me feel comfortable. And my clinic's in Paramus, and people will come all the way from Paramus, not that far, but in Berg County it is, and they'll say, well, we go to Miller's, we just get more education, more information to make a decision. And I think that's really part of what we do also at our clinic, is allowing that time, which sometimes we don't always have. So. Well, listen, this has been a great interview. Is there anything else you want to tell us about that's coming up on the horizon? Any new meds that you're hearing, or anything else that's exciting before we finish up?
Well, I guess the newest thing here is Progert, which is a human strain, trillion unit probiotic that we're using. Bob is using this clinically with some of his patients downstairs. Now, again, it's a medical food. We can't make any claims for this product.
Right.
Certainly. But he's using it very well with people with, very successfully with people with IBS, Crohn's disease.
Okay.
And now we're looking to other applications for it. Again, it's just all anecdotal stuff. We're not making claims, but also ADD, some neurological disorders. People are starting to just try it. Just taste it, because you can make your own yogurt out of it,
right,
which happens to be delicious. Although we have a controversy here right now. I usually make it with ultra-pasteurized whole milk.
Okay.
The nutritionist makes it with half and half, and hers is a lot creamier than mine. So, but it doesn't dilute the effect of the probiotic. And again, it's another thing that's affecting the microbiome. And there's been so much written about that recently that I think we're only doing good by providing this product to as many patients as we can. So that's probably the latest and the greatest here.
Oh, excellent. Well, listen, thank you so much for your time, David. I learned a lot today. I hope you guys learned something from this. I sure did. And if you ever want to come on down here, like David said, with some of the medications, really discussing with the pharmacist or with Bob, and really getting into, what are you experiencing? Maybe some natural remedies, some other things. What's Bob's last name again? Lukasic. So Bob Lukasic is a great resource here as well. And I just encourage you to look for possibilities and really educate yourself and talk to your pharmacist. There's a great resource, David and other pharmacists, as far as more information about what you're taking in and other options and alternatives. So have a great day, and thanks for joining us. Thanks very much, David.
Thank you very much.
Have a good one. Bye.